Good evening, you're with Channel I and this is IMED. On IMED we usually talk about different kinds of diseases and the complications which comes along with those diseases and the treatments that you could take in order for you to get remedied or cured. And today, now in the previous week we did talk about a disease which is quite prevalent in Sri Lanka and quite timely as well, considering the times, which has been in the surge, I would say, which is about dengue. Now, last week we did talk about the symptoms, complications and the treatments in general, and today we will be focusing on a specific topic, which is prevention of dengue in Sri Lanka. So to do the honors, we do have with us Dr. Nimalka Pannilahetti with us. She is a senior consultant community physician at the National Dengue Control Unit. A very good evening to you, Doctor, and welcome aboard the show.
Good evening.
Now, Doctor, let's get right on with the questions. If you could give us a general explanation about dengue, say for example, if you could describe the present situation in the country with regards to dengue, if you could use some statistics.
Yes, dengue, we all know it is a viral disease transmitted by mosquito called Aedes. We all talk of dengue nowadays because as we all know there are outbreaks occurring nowadays. We call them mid-year outbreaks, which is associated with the monsoonal rains, and towards the end of the year also we experience outbreak with the northeast monsoonal rains, mainly in the northern and eastern provinces. So far for this year, we have received notifications from hospitals where the patients are admitted, which exceeds 36,000 up to now. So we hope that with time this number could be increased, and as of now more than 2,700 cases get reported per week.
So, Doctor, that's a huge increase compared to the previous years.
Yes, because if the number of cases are exceeded at this rate, probably we will have to expect more cases with time. So, for June alone, we have received more than 12,000 patients, whereas this number was 3,000 for the last year for the comparable period.
And Doctor, if you could educate our viewers about how the disease of dengue has evolved throughout history, because you cannot expect that dengue has not evolved. Humans basically evolved. So if you could explain the history of dengue.
Yes, in Sri Lanka, dengue case was first serologically identified in 1962. After that, sporadic cases have been reported, and a massive outbreak was experienced in 1989 with a significant number of deaths, and thereafter the attention was drawn to dengue and its prevention. And in 1996, dengue fever was made a notifiable disease by the Ministry of Health. It was gazetted to be a notifiable disease. Thereby we get notifications from the admitted number of admitted patients. And in early 20s, the number of cases say 1,000, 2,000 per year. But after 2009. We got increased number of dengue patients, which exceeded about 30,000 cases annually. Thereafter, in 2017, we got nearly 186,000 patients. So as of now, we get outbreaks. So this is outbreak-prone disease, and we can see with this data that endemicity of dengue is sitting at a higher level in the community.
So I think we cannot take dengue for granted. You have to keep in mind, and according to the statistics, it proves that dengue is not something to be taken lightly. And Doctor, if you the question I'm asking now is very obvious, which is has dengue been eliminated in Sri Lanka, which is obviously not. Dengue is still prevalent in Sri Lanka. Now, my question to you is, if it's not eliminated, the reasons why it hasn't been eliminated yet?
Yes, in dengue we all know that it is a virus disease, and there are some diseases which have been eliminated in Sri Lanka. For example, polio. That is, we attribute the elimination strategy to the potential vaccine that is there for the prevention of transmission of polio. If you consider dengue, the main problem is that there are 4 serotypes of virus that transmits dengue, and there is up to now there is no potential vaccine to eliminate all the 4 serotypes. And even if there is a potential vaccine, we have to put major trust on the preventive activities, because even if there is a vaccine, it will be costly, and all the citizens may not be able to afford it, so we have to give it to high risk groups. To answer your question, why we have still not close to the elimination, is because since this is a vector-borne disease, and to kill the virus there is no potential treatment. For example, if we take malaria, there are drugs to kill the parasite which cause malaria. In case of dengue, we have to give only the supportive treatment. For example, if the patient gets fever, we have to support by drugs to control fever, and if there is fluid leakage, we have to support by rehydration. Like that, we have to give supportive treatment until the antibodies are developed within the body and patient is cured. So therefore, and the other thing is that the dengue transmission is related to the human's behavior. As we all know that there are multiplicity of breeding places in and around, and since this dengue mosquito breeds in a small amount of containers where water is held, we have to regularly eliminate these breeding places from our environment, so that we will have zero breeding in our community, and mosquito is not laying eggs in the surroundings. Until we achieve that state, I think we have to keep on cleaning our environment regularly. Especially, we have to expedite these activities during these outbreak periods.
I think our viewers might know, and this is very common knowledge, dengue is a mosquito-borne disease, and which means it is transmitted to humans through mosquitoes. It's a virus, and doctor, if you could educate our viewers on what are the transmission methods of dengue.
Yes, dengue is mainly transmitted, it is transmitted by a mosquito-borne disease, and from infected person, that is if someone is having dengue, the dengue virus could be within that person's blood for about 7 days. So during that period, if a mosquito bites that patient, the dengue virus is entered through the blood to the mosquito. So this mosquito can infect another person after about 1 week, because during that 1 week the virus can amplify in the replicate within the mosquitoes. So mainly it is transmitted by the mosquitoes, and there are instances where the dengue virus is transmitted through the placenta from pregnant mother to the fetus. So there are also documented evidence that through the blood products and tissues it could be transmitted, but in practice what we have seen here, mostly it is through the mosquito, and few instances from the mother to the fetus.
And those were some ways that the dengue could be transmitted to humans, and just like you said, doctor, there is a risk of babies getting dengue from their mothers when inside the time of pregnancy as well. Now, Doctor, I did mention that Dr. Nimalka is working at the National Dengue Control Unit in the beginning, and it is under the Ministry of Health, if I'm not mistaken. And what is the role of the National Dengue Control Unit when it comes to controlling dengue in Sri Lanka, Doctor?
National Dengue Control Units is a central agency which develops policies and guidelines and coordinate dengue prevention activities with other sectors apart from the Ministry of Health, and for monitoring and implementation of dengue prevention activities, the dengue control unit is responsible. And further, for the disease surveillance activities, we all know that we have to get the reported cases from the hospitals timely, completely, and also the death surveillance, clinical training, management. So all these activities are coordinated by the National Dengue Control Unit, and the activities to be implemented are at the division levels, that is at grassroots level. These activities are implemented by the Ministry of Health, the medical officers of health. In Sri Lanka, there are about 360 medical officers of health, where about say 120 are high risk and priority high risk medical officer of health areas, mainly those which are located in Western Province, Central Province, Southern Province, Suburban Province, and Northern Province, etc. So these dengue prevention activities which are implemented by the medical officers of health are also coordinated by the district level officers, as well as parallelly these are monitored from the central level by the National Dengue Control Unit.
Okay, Doctor. Now let's move on to how our general public out there could use their role and in an attempt to get rid of dengue once and for all, reducing the risk of dengue. What can the general public do in their own time, personal and household protection wise? What can they do?
In dengue prevention, all the households have a very key role. We all know that mosquito breeds in it lays eggs in water receptacles which are prevalent in domestic and peri-domestic areas. For example, water holding containers, discarded items, say ponds, roof gutters, concrete slabs, tires, water tanks, storage tanks, so barrels, all these containers which may have either scanty amount of water or full water. Mosquito can enter these breeding places and lay eggs above the water surface. So unless we clean these the discarded items and our roof gutters, slabs regularly, these mosquitoes lay eggs, and after about 1 week the adult mosquito emerges. So we have to break this cycle. And nowadays we all know that the medical officer of health also can't deploy the inspection teams to the households due to the situation, and our mothers and community and occupants, they all know where this mosquito breeds. The only thing is that we don't act upon our knowledge. That is the main thing, and I kindly request these viewers to allocate at least 30 minutes regularly with all the family members to inspect your breeding sites, inspect your potential areas, and eliminate the breeding places so that you are free from the risk. The other thing is that we all know that the virus enters our body through the mosquito bites. There are repellents through the skin. Yes. So if we are protected from the mosquito bites, we can escape the disease.
I think that's actually a very good point that you brought up, Doctor, because you did mention earlier to this discussion that school children are very prone to, are very exposed for getting dengue. So if you could elaborate on the fact that what type of measures can parents take to protect their children from mosquitoes?
Yes, according to our data, about 30% of the dengue patients belong to the age group age 5 to 19, which implies that they might have caught the disease at their schools. We all know that this mosquito bites during morning and mainly in the evening. So during this time, the children's may be in the school or at their private classes or at homes while playing or watching TV inside or outside. So we have to protect these children. One thing is that we can, if it is a preschool child, we can, first thing is that the parents must get together with the school teachers and principals to clean the school premises regularly. And to prevent the mosquito bites, we can apply repellents. There are repellents approved by the Register of Pesticides which are available in the supermarkets, and for domestic use we can apply citronella oil mixed with coconut oil. And importantly, if a child develops fever, we have to take regular measures to get the medical advice without delay. That is very much important, rather than overlooking the symptoms. To keep the child at home or even fever patient at home is very much disastrous.
If any parents are watching today's show, I think that's something that you should take note very much. And Doctor, we have come towards the end part of the program as well. Now, I would like to know my ultimate question to you would be, what is your message to the Sri Lankans out there when it comes to, given the situation that dengue is rising in these times, so what is your message to the Sri Lankans?
Yes, our surveys reveals that a lot of breeding places inside and outside our homes remain, and also in the working places and schools and construction sites. So we have to regularly eliminate them. For those places that we cannot eliminate, we have to get the advice from the medical officer of health or the public health inspector with regards to the applying chemicals to places like, say, water tanks or slabs that we cannot remove or destroy. By any chance, if someone has fever at your home or in the working place or school, on the second day of fever, we have to at least seek the medical advice, because dengue is a preventable disease, and by correct advice and by correct hydration only, we can prevent the complications. So it's important, if there are small children less than, say, 8 years, or households who have comorbidities like hypertension, diabetes or kidney disease or any other disease, and pregnant mothers especially, have to seek the medical advice without undue delay, or else you have to visit the nearest hospital to seek advice and get necessary investigations for prevention of complications.
I think, just like the doctor said, it's not just the responsibility or the duty of the local authorities. Everything and basically every responsibility lies on all citizens in the country. So with that, we have to conclude today's program of IMED Doctors. So thank you so much. We did have with us Dr. Nimalka Pannilaheti, the Senior Consultant Community Physician at the National Dengue Control Unit. Thank you so much for being here in an attempt to educate the public, Doctor.
Thank you.
With that, we conclude today's program of IMED. Tune in next week. Until then, have yourselves a pleasant day ahead.